Going to the doctor in English can feel stressful even when your English is usually good. The difficult part is not only the medical vocabulary. It is also the speed of the questions, the unfamiliar expressions, and the pressure of explaining exactly how you feel. Today, we are going to walk through the whole process from booking an appointment to picking up medication. You will hear the kinds of questions that receptionists, nurses, and doctors actually ask. Let us start with making an appointment. You call the clinic and say, "Hi, I'd like to make an appointment to see a doctor." The receptionist may ask, "Are you an existing patient or a new patient?" An existing patient means you have already been seen at that clinic before. If it is your first visit, you can say, "I'm a new patient." The receptionist may then ask, "What are you coming in for?" They usually just want a short reason for the appointment. You can say, "I've had a sore throat and a cough for a few days," or "I've been having some lower back pain," or "I'd like to talk to a doctor about some recurring headaches." The receptionist may ask, "How urgent is it?" If it is not an emergency, you can say, "It's not an emergency, but I'd like to be seen as soon as possible." You may hear, "The earliest appointment I have is Thursday at 10:30. If that works, say, "That works for me." If it does not, say, "Do you have anything later in the day?" Or, "Do you have anything available on Friday?" The receptionist may also ask for your date of birth, phone number, and health card information. If you did not hear a question clearly, say, "Sorry, could you repeat that?" You can also say, "Could you say that a little more slowly?" These two sentences are useful in every medical conversation. Now imagine that it is the day of your appointment. You arrive at the clinic and walk up to the front desk. You can say, "Hi, I have an appointment at 10:30. The receptionist may ask, "What name is the appointment under?" You can simply give your name. They may ask you to confirm your address or phone number. You may also hear, "Has anything changed since your last visit?" They could be asking about your address, medications, allergies, or insurance information. If nothing has changed, say, "No, everything is the same." If you have forms to complete, the receptionist may say, "Please fill these out and bring them back to the desk." Fill these out means complete the forms. The form may ask about your current medications. It may ask, "Are you currently taking any prescription medications?" A prescription medication is medicine that has been prescribed by a healthcare professional. The form may also ask about allergies. You might see, "Do you have any known allergies?" If you are allergic to a medication, be specific. For example, "I'm allergic to penicillin." You may also need to describe what kind of reaction you have had. If you are not sure of the exact medication name, tell the healthcare professional that you are not sure. Do not guess about medication or allergy information. After you check in, you may need to wait in the waiting room. A nurse may come out and call your name. They may say, "Come on back." "Come on back" is a casual way to invite you into the exam area. The nurse may start by saying, "I'm just going to take your vitals." Vitals usually include things like blood pressure, heart rate, temperature, and sometimes oxygen level. They may say, "Go ahead and step on the scale." Then, "I'm going to check your blood pressure." You may hear, "Rest your arm here and try not to talk for a moment." Then the nurse may ask, "What brings you in today?" This is one of the most common questions in a clinic. It simply means, "Why are you here today?" Try to give a short summary first. For example, "I've had a cough for about a week and it seems to be getting worse." Then let the nurse ask follow-up questions. You may hear, "When did it start?" You can answer, "It started last Tuesday," or "It started about 5 days ago." Another common question is, "Has it been getting better, worse, or staying about the same?" You can say, "It was mild at first, but it has gotten worse over the last 2 days." The nurse may ask, "Is the cough dry or productive?" A dry cough means you are coughing without bringing up mucus. A productive cough means you are coughing up mucus or phlegm. You can say, "It's mostly dry," or "I've been coughing up some mucus." You may be asked, "What color is it?" If you do not know how to describe it, simple words are fine. You can say, "It's clear, yellowish, or greenish." The nurse may ask whether you have a fever. You can say, "I had a fever yesterday, but I haven't checked it today." Or, "I haven't had a fever." They may ask, "Any shortness of breath?" Shortness of breath means feeling like it is difficult to get enough air. You may also hear, "Any chest pain?" or "Any wheezing?" Wheezing is a whistling sound when you breathe. If you are not sure what a word means, ask. You can say, "Sorry, what does wheezing mean?" Medical conversations are not a test. It is more important to understand the question than to pretend you understand. The nurse may also ask about pain. You may hear on a scale of 0 to 10, how bad is the pain? 0 usually means no pain, and 10 means the worst pain you can imagine. You can say, it's about a 6 right now. They may ask, is it constant or does it come and go? Constant means it is there all the time. Comes and goes means it appears and disappears. You can say, it comes and goes, or it's there most of the time. Another useful question is, what does the pain feel like? You can describe pain as sharp, dull, burning, throbbing, cramping, or pressure-like. A sharp pain feels sudden and intense. A dull ache feels less sharp but may stay for a long time. A throbbing pain feels like it pulses. If none of those words feels right, describe it in your own simple words. You can say, it feels like pressure here, or it feels tight when I take a deep breath. The nurse may ask whether anything makes the pain better or worse. You can say, it gets worse when I bend over, or it feels better when I lie down. You may also be asked, have you taken anything for it? You can answer, I took some over-the-counter pain medicine last night. Over-the-counter means medicine you can buy without a prescription. If you know the name and dose, tell them. If you do not know, say, I don't remember the exact name. After the nurse finishes, the doctor will usually come in and ask more questions. The doctor may start with, tell me a little more about what's been going on. What's been going on means what has been happening. This is your chance to explain the problem in more detail. A useful structure is when it started, what it feels like, what makes it better or worse, and what other symptoms you have. For example, it started about a week ago with a sore throat. Then I developed a cough, and over the last 2 days I felt more tired. I had a fever yesterday, but I don't think I have one today. The cough is worse at night. This gives the doctor a clear timeline. The doctor may ask, have you been around anyone who's been sick? You can say, someone in my family had a cold last week. Or, not that I know of. Not that I know of. Not that I know of means you are not aware of any example. The doctor may ask, any recent travel? Or, any new medications? They may also ask about smoking, alcohol, sleep, diet, stress, or exercise depending on the problem. Answer as accurately as you can. The doctor may then say, I'm going to take a listen to your lungs. Take a listen is a casual way to say they are going to listen with a stethoscope. You may hear, take a deep breath in, then, and breathe out. The doctor may say, one more deep breath, or can you open your mouth and say ah? They may check your throat, ears, eyes, or lymph nodes depending on your symptoms. You may hear, does it hurt when I press here? You can say, a little, or yes, that's pretty tender. Tender means painful or sensitive when touched. If the doctor wants tests, they may say, I'd like to run a few tests. Run a test simply means perform a test. They might order blood work, a urine test, an x-ray, or another test depending on the situation. You can ask, what are you checking for? You can also ask, do I need to do anything to prepare for the test? If the doctor recommends medication, they may say, I'm going to prescribe something for you. Prescribe means officially order a medication for you. You can ask, what is this medication for? You can also ask, how often should I take it? Or should I take it with food? Another important question is, are there any common side effects I should know about? If you are taking other medications, ask, is it okay to take this with my other medications? If you have allergies or have had bad reactions to medications before, mention that clearly. Do not be afraid to ask the doctor to explain something again. You can say, could you explain that in simpler terms? Or, I just want to make sure I understand. Then repeat the instructions in your own words. For example, so I take 1 tablet twice a day for 7 days, right? This is a very good way to avoid misunderstandings. The doctor may give you advice about rest, fluids, activity, or monitoring symptoms. You may hear, keep an eye on your symptoms. Keep an eye on means monitor something carefully. The doctor may also say, if it gets worse, come back in. Or, if you develop any new symptoms, give us a call. If the doctor uses a word like follow-up, it means another visit to check how things are going. You can ask, when should I follow up? The doctor may say, if you're not feeling better in a week, make another appointment. Before you leave, make sure you understand the plan. You can ask, is there anything specific I should watch for? You can also ask, when should I seek urgent care? If a healthcare professional gives you specific warning signs, make sure you understand them clearly. Now imagine that the doctor has sent a prescription to your pharmacy. You go to the pharmacy and say, "Hi, I'm here to pick up a prescription." The pharmacy staff may ask for your name and date of birth. They may say, "It's not quite ready yet." Not quite ready yet means they need a little more time. You can ask, "About how long will it be?" They may say, "Give us about 15 minutes. When the medication is ready, the pharmacist may go over the instructions with you. Go over means review or explain. They may say, "Take one tablet twice a day," or "Take this on an empty stomach," or "This may make you drowsy." Drowsy means sleepy or less alert. If you did not understand something, ask the pharmacist. You can say, "Could you explain when I should take this?" Or, "Can I take this at the same time as my other medication?" You can also ask, "What should I do if I miss a dose?" It is better to ask than to guess. Sometimes the pharmacy may say, "We're waiting for the doctor to clarify the prescription." That means the pharmacist needs more information before filling it. You may hear, "We've sent a request back to the prescriber." In that situation, you can ask, "Should I check back later today?" Check back means contact or return again later for an update. Now let us review the most useful phrases from the whole visit. To book an appointment, "I'd like to make an appointment to see a doctor." To explain the reason, "I've had a sore throat and a cough for a few days." To check in, "Hi, I have an appointment at 10:30. When they ask why you are there, "I've been having some lower back pain." To describe timing, "It started about 5 days ago." To describe change, "It has gotten worse over the last 2 days." To describe frequency, "It comes and goes." To describe pain, "It feels sharp," "It feels like pressure," or "It burns." To explain what makes it worse, "It gets worse when I move." To ask about a test, "What are you checking for?" To ask about medication, "How often should I take it?" To ask about side effects, "Are there any common side effects I should know about?" To ask for simpler English, "Could you explain that in simpler terms?" To confirm instructions, "So I take one tablet twice a day, right?" To ask about follow-up, "When should I follow up?" To pick up medication, "I'm here to pick up a prescription." These are not complicated sentences, but they give you control when the conversation starts moving quickly. The goal is not to memorize every medical word. The goal is to know how to describe what you feel, ask for clarification, and confirm what happens next. If a doctor uses a word you do not know, ask what it means. If the instructions are too fast, ask them to repeat them. If you are not sure whether you understood, repeat the plan back in your own words. Clear communication is more important than perfect English. If this episode helps you, listen again before your next medical appointment. On the second listen, focus only on the questions the nurse and doctor ask. On the third listen, pause and answer each question out loud as if you were really at the clinic. The more familiar these questions become, the less stressful the real conversation will feel. And if you want more real-life English you can actually use, subscribe and keep practicing with me. I'll see you in the next episode.